Hi, my name is Michael Conlon. I'm a physical therapist with Finish Line Physical Therapy. Today we're going to talk about iliotibial band syndrome. Patients will often complain of lateral knee pain. It's important to differentiate between IT band and patellofemoral, which is a tracking problem of the kneecap. Some of the key tests that we're going to do is the noble compression test. The pain is typically isolated over the lateral epicondyle of the femur. We're going to place our hand just above on the IT band, above the condyle, and move the knee from 90 degrees flexion into a fully extended position. This will often replicate the complaint that the patient has of lateral knee pain. Patients with patellofemoral syndrome will often complain of global pain around the kneecap. They'll complain of pain walking down the stairs, running downhill if they're a runner, and with prolonged sitting. IT band syndrome is typically with prolonged walking or running. During the interview phase, patients will often state that they don't want to flex their knee, causing the increased pain on the lateral side of the knee, that they'll want to walk or run with the knees in full extension. In addition to the noble compression test, it's also important to test the flexibility of the IT band as well as the hip flexor. I'll have the patient come down to the end. Okay. Roll back onto your back, bring that knee all the way up so you have them maximally flex their opposite hip, and you'll be looking at two things, the flexibility of the hip flexor as well as the flexibility of the IT band. A positive test for the hip flexor would demonstrate increased flexion in the hip where the knee is above the horizontal. Positive test for the IT band would be the knee is pulled up and out to the side, indicating that the IT band is inflexible. Finally, to confirm the diagnosis, it's always important to palpate along the distal aspect of the IT band to confirm your diagnosis. And now I'd like to show you some exercises you can have your patient do at home. The first exercise we're going to use for the IT band is the roller. We're going to start on the outside part of the IT band distal towards the knee. Gently and gradually rolling 2 inches up towards the hip, 1 inch back. You're going to continue to roll until you reach your hip area. This should be done for about 1 or 2 minutes, 1 to 2 times a day, repeating on both the outside part of the quadricep as well as the central portion. The next exercise we're going to cover for the IT band is an IT band stretch. Start by having the patient maximally flex their hip and then slowly adduct the thigh across the midline. We're going to hold this stretch for about 20 to 30 seconds, and we're going to repeat 1 to 2 times. You can gradually increase the stretch as tolerated.